we are not just dentists. We are dentists treating a patient as a whole. One of the main bacteria that are causing periodontal disease is Porphyromonas gingivalis. There are certain molecules that they are able to emit and start creating this neuroinflammatory process that happens in the brain. Everything is interconnected.
Welcome to BrainStorm by Us Against Alzheimer's, a patient-centered nonprofit organization. Your host, Meryl Comer, is a co-founder, 24-year caregiver, an Emmy Award-winning journalist, and the author of the New York Times bestseller, Slow Dancing with a Stranger.
This is BrainStorm, and I'm Meryl Comer. Forget smile for the camera is just a photo trick. In the age of prevention, think of your mouth as a control panel or a gateway to the rest of your body. Research now shows that poor oral health increases your risk for heart disease, diabetes, frailty, and even cognitive decline. Today, we're joined by Dr. Flavio Rasetto, a noted Washington, D.C. prosthodontist, former faculty member, and postgraduate lecturer in his specialty at the University of Maryland School of Dentistry. Dr. Rasetto, thank you for joining us.
Thank you. It is a pleasure to be here, Meryl.
Doctor, today the field of dentistry is highly specialized. How would you explain what you do in practical terms?
Yeah, the specialty of prosthodontics is one of the 12 specialties that we have in dentistry. And we as prosthodontics are able to restore patients' dentition with veneers, crowns, removal partial dentures, complete dentures. The advent of dental implant has provided us a great opportunity to help patients to change life. We do treat patients that they suffer from trauma, facial trauma. We need to have prosthesis done after cancer reconstruction, or patient that has been missing teeth that they didn't have the tooth bath, since they were born, and we can restore those patients as well. So basically, in general terms, we are the specialty that manage patients that hasn't have been seen by any other dentist that they cannot solve problems. They come to us to see if we can help them out.
How has academic dentistry changed since your years in postgraduate education? What's different today?
A lot of things have changed since I did my program, and for good, for the patient's benefit and for us as a profession. So we have incorporated in a routine basis a cone-beam CT scan, which is 3D images that can help us to diagnose and treatment plan patients in a much more accurate fashion, especially for patients that need to have reconstructions after they have lost all the dentition with dental implants. So we can interact with oral surgeons, planning or periodontists for this type of reconstruction much more efficiently. We have incorporated digital technologies such as intraoral scanners that we can actually capture images of the patient's dentition, kind of taking a video of their teeth without using that gooey material that patients used to hate when we will be making impressions to make molds. So that has changed completely the way that we are performing dentistry, helping patients going through a much more favorable experience going through dentistry. We have incorporated milling machines that we can use in our offices to fabricate same-day crowns or restorations for patients. Years ago, we didn't have that capability. We definitely see the patients much more comprehensively, and we look at patients not only from the point of view of teeth only, but looking at airway. We are looking at patient growth and development. So we are becoming much more comprehensive and interacting with other specialties as well. So it is a very exciting time to be in dentistry.
Has fear of going to the dentist changed generationally?
It's interesting. As we are going through many years in dentistry, there is going to be always a percentage of patients that are still remembering that particular moment that has been very traumatic to them. Especially older, patients has had the exposure to dentistry without the use of anesthetic. And early on in life, they have been obviously traumatized. And once you traumatize a young patient, that experience remains with them for the rest of their life.
And Dr. Rasetto, what warning signs of oral disease do people too often ignore before they become problems and more severe?
One of the problems that we face is that there are some of these conditions that are chronic conditions, either caries or periodontal disease are both caused by bacteria and they are chronic. And sometimes you could have an extended period of time having these conditions that are brewing in your mouth, that they are obviously developing, and you don't have yet symptoms. But certain things that are important for patients to know is, number one, bleeding gums. If you have brushing techniques or flossing and you start bleeding, that is a sign that there is early stage of either gingivitis or periodontal disease, which is important for you to see the dentist. Then another important part is bad breath. If there is a change, and it's called halitosis, a change in the taste of your mouth, and you start feeling that something is not pleasant, that could be linked with bacteria that are called anaerobic bacteria that are into the pockets that can obviously affect the bad breath that patient will have. As far as the coating that build up in the tongue and some other soft tissues areas, so the patient have to be aware of those factors that can be leading to this type of problems.
Healthy aging today is all about preserving function, independence, quality of life as people age. Where does oral health fit in?
Healthy mouths will have the possibility to maintain patients in function, not only for cosmetic purposes, but for functionality, and then minimizing the risk to have other coadjuvant or other conditions that they could be affected by. We are hosting millions of bacteria that are very smart, that they colonize around our teeth and gums. And if we are not able to eliminate properly, then this is going to be either causing decay or gum disease, and especially gum disease, which is called periodontal disease, starting from gingivitis first, but then if it started affecting the level of the bone and bone will start obviously reabsorbing, then the bacteria will have an access into the bloodstream that can be actually moved to other part of the patient's body. And that's why this connection of oral health and systemic disease became much more noticeable. There is a genetic component, the type of bacteria that each patient carry, the immune system that we have, the diet and the habit that each patient will have. There is few factors that plays a role why certain patients become disease with either caries or gum disease, and other patients are not. So if I have a patient that they are not maintaining very good oral hygiene, but those factors are not creating issues for them, they could go through their life without major issues in their mouth. Doesn't mean that they shouldn't be seeing the dentist, because still, even though they don't have perhaps signs or symptoms yet of complaining of any problems, the presence of bacteria can be still leading into the bloodstream because there are certain level of inflammation that happen because of the presence of the bacteria.
Were you surprised, Dr. Rasetto, when you saw the research about the link to oral inflammation and Alzheimer's?
Good question. I always thought that we are not just dentists. We are dentists treating a patient as a whole. And we cannot be talking about organs that are separated. Everything is interconnected. Obviously, the mouth, it is a very dirty area, very, very dirty. We are hosting bacteria, unfortunately, all the time. And the soft tissue and the intricacy of how the tooth structure is interacting with the gums and the shape of our teeth, obviously, that will have a port of entrance for these bacteria to get in. And I do see now how different it is the way that we are approaching our patients. The first thing that we are doing is we are spending enough time to understand the patient's overall medical condition before we start talking about teeth. I can see this all the time, that patients sometimes are surprised on how much time I dedicate talking about some other things before I get into the patient's mouth. So I'm glad that the community now is much more involved in educating our patients' population regarding the importance of the correlation between oral health and Alzheimer's and other, obviously, systemic conditions.
So, how does inflammation in the mouth become a brain health issue? Is it crossing the brain-blood barrier?
One of the main bacteria that are causing periodontal disease is Porphyromonas gingivalis, we call it PG. And once the presence of pockets and bacteria that are getting into the bloodstream and they are being mobilized and translocated through the entire body, as it goes through the blood-brain barrier, it goes into the brain, and they like to be attached to areas around the neurons, and they start inducing, and there are certain molecules that they are able to emit and start creating this neuroinflammatory process that it happens in the brain. So the key is to go back to where the Porphyromonas gingivalis are, in the mouth primarily. So that's where we need to pay attention and emphasize the importance of having very good oral health is so crucial for the overall condition of the patient's health.
How do you begin to speak to patients about an emerging science so that it motivates them to take better care of their teeth without overstating the certainty that there's a direct linkage because the science is so new?
I provide evidence that research has shown us the importance of having the best type of treatment that we can provide to them, not only for cosmetic purposes, because sometimes they come only for that reason, but from the point of view of oral health, and describing the reason why has been enough evidence that the association between oral health and, in this case, Alzheimer's and cognitive decline, it is a reality. And I'm trying to explain the importance of minimizing the risk for them to suffer perhaps this type of problem.
Doctor, many in our audience care for loved ones with Alzheimer's. And we've all had the experience that it is very challenging to take care of a loved one with regard to their oral health. What do you say to the caregivers out there who know what they should be doing and the care is important, but when a loved one refuses the care?
That is a tough one. And I faced that myself with my father. And I understand that nothing is perfect. And what I usually tell patients is patience is very important. To be patient, to be resilient, to be consistent, to learn to play as much as possible and find the things that could be motivating them to be engaged. There are certain, obviously, type of techniques that we can review with the caregivers to see what are the different type of accessories and instruments that we can be working on. Informing them about the diet, which does plays a major role, because as one of the components of caries and periodontal disease, diet plays a major role.
As a caregiver, I was always concerned what my husband and my mother might be ingesting, so that I used what you use for children because I felt that was probably the safest if they ingested.
The type of management of the oral hygiene technique, obviously, is very true that when you are start putting certain things like a brush into the patient's mouth, some of them could even be hurting you, where they will try to be biting your fingers. I already faced that myself as dentist. So we had to be cautious about that part. And then the toothpaste, obviously, when we are using toothpaste, the amount of toothpaste that we are delivering is important. So it has to be pea size. Sometimes we see that people are going to be adding 2 centimeters of toothpaste into the brush, which is not necessary. And then obviously, if we are utilizing toothpaste that has high concentration of fluoride, the main issue is that if the patient reach a point where they are not aware and they are trying to swallow, that could be creating obviously a side effect. The baby toothpaste that you are referring to, is going to be generating some foam into the surface to help to facilitate the process of brushing, and is reducing the risk factors of not inducing any major irritation on the patient's stomach. You are finding ways to trying to go through each day, helping them as best as you can.
When you have a nonverbal patient, what are the clearest signs that they may be in oral pain?
Those are the moments that we have to be paying attention to what type of body response does the patient has. If there is any type of eyes movement or expression, facial expression that are linked with perhaps something that is creating pain. When they are trying to chew something, it's definitely necessary for us to clinically identify what is the source of the problem. So the sooner that we get in areas of the mouth that they have perhaps an infection, the better that we're going to be to reduce the chance for this infection that we have already identified that could be leading to a complication systemically. The dental pulp could suffer what is called necrosis, and then the process of dying slowly, and sometimes you don't have symptoms, but then you find radiographically those focal infections that are not yet perhaps inducing pain, but they could be very, very detrimental for the overall health of the patient.
Thank you for addressing some of these issues that people live with every day, and they're not often talked about. Speaking of aging, we have a generation now that are outliving their dentures. No one ever thought about that. What do you do for the 70 plus set these days?
So if the patient has a good overall health, procedures that we know that are predictable, and they can provide with the appropriate stability for them to have adequate function, adequate aesthetics, that will make them feel very comfortable to continue on with their life.
How do you reach into communities who face barriers to treatment, either because they can't afford treatment, or it's just culturally just not part of their regular hygiene?
Before coming to America, I practiced 5 years back home, and I dedicate an entire day treating patients that they were in need. And I moved to the first world. I went through all my training, and I still now see that there are places that patients unfortunately cannot receive the right care because of financial burden and the amount of investment they have to do. I think that there is an effort that has to come from the government, from the community, from the different organizations that are related with, in this case, our profession. The University of Maryland has done this, where I used to go with the residents as a group and care for Indian reservations in Navajo reservation. It was part of Mission of Mercy, that we will go and spend 2 days or 3 days providing service to our patients, and we will see so many patients that they couldn't have access to a private sector, a dental service. So I definitely see that there is so many things that we could do to improve. I belong to this organization that we are, seeing Holocaust survivors patients. So I offer time in my office with my colleague to see some of those patients, for free. And I think that it is a constant, effort that we as clinicians could be doing to help patients to receive care.
Dr. Rasetto, what has that experience taught you about dignity and sense of self and more importantly, early access to care.
We have to understand that there are people that they need certain services that we take for granted. And we as a community can really make a difference when all of us are putting that attitude toward helping people in the way that we could, obviously based on what we are doing. And so it was and it still remains a wonderful feeling and experience.
Well, thank you for your service. Dr. Rasetto, if people want to avoid the dentist, what should those must-do habits be each day when it comes to oral health?
We spend time learning how to have a very good oral hygiene technique. And your dentist and your hygienist can review and provide all the necessary support. And then that motivation that you get out of that particular session has to stay and stick with you, because that's the main issue is when you provide this training on patients and you leave the office and you feel motivated, and then after a week and you start lacking. We had to pay attention to what we eat. When do we eat? It's important for us to have the discipline to understand that if we like to have sugary drinks, and if you're sipping through the course of the day and in between meals, having snacks, those are the nutrients, the ideal fuel for the bacteria that you are hosting to really have a feast, either if you suffer from decay or even if you suffer from periodontal disease. And the third part, if possible, trying to maintain a regular dental visit. And if you cannot do a comprehensive treatment because of the finances, still trying to maintain either every 3, 4, or 6 months a recall program with your dentist, so we can, number one, help you to diagnose problems, and number two, preserve what you have.
Thank you, doctor. We know your patients are waiting. Our guest today has been Dr. Flavio Rasetto, a notable Washington, D.C. board-certified prosthodontist affiliated with the University of Maryland School of Dentistry, who spent his career helping patients restore function, comfort, confidence, all contributing to their oral health. And don't forget, join us for the 11th Annual National Alzheimer's Summit on September 16th and 17th. This year's theme, The Time Is Now, advocating Alzheimer's policy for every generation, that highlights the importance of caring for the brain at every stage of life, from childhood through the older adult years. Go to usagainstalzheimers.org/allsummit to learn more and register for this virtual event. That's it for this edition. I'm Meryl Comer. Thank you for brainstorming with us.
Support for BrainStorm by Us Against Alzheimer's comes from Genentech. Genentech is committed to pushing the boundaries of scientific discovery in Alzheimer's disease by researching and developing treatments to preserve what makes us who we are. Subscribe to BrainStorm through your favorite podcast platform and join us for new episodes on the first and third Tuesday of every month.